Hey, it's Melanie Petro, and we are about to do some resurfacing, and this story is really interesting, and it's really real, and this lady is nice enough to want to share it with y'all. Mostly, why do you want to share?
So no one else goes through what I went through.
So nobody else goes through what she went through, which is really admirable, and she's willing to show her face, but I'm going to protect her. So she wants to tell us, we're about to do some resurfacing. What are the things about your skin that bother you?
The scarring more than anything.
And what's the scarring from?
When I was pregnant with my first son, I broke out with cystic acne.
So bad cystic acne from pregnancy, and pregnancy does a lot of things. Acne and hormonal changes are certainly a big thing that can happen. So she decided to go try to find somebody to help you with the scarring.
Yes, ma'am.
And so you went. Did it take you a while to build up the nerve?
It did, like 4 years.
4 years, really?
4 years. Because
Why
I was scared.
What were you scared of mostly?
Because when I first started researching, all that was available was the dermabrasions.
So
where you went in the hospital, basically.
Real aggressive type things.
And then they come out with the Fraxel.
Okay.
And that's what I thought I was getting. That's what I paid for was Fraxel, and that's what I was told that it was.
So you finally went, and how did you choose where you were going to go?
Because they advertised a lot on local TV channels.
Okay.
Some of the news did, little segments with them, and I had heard a lot about them here in Birmingham.
Okay. Did you know anything about credentials, if they were facial plastic surgeons or dermatologists or?
I did not.
Plastic surgeon?
No.
Okay. So you go in and you met with a doctor or no?
Well, I assumed he was a doctor. He's the owner of the company.
Okay.
And we discussed what would be best for me, what, procedure, and I agreed. Then I went up front, paid for it, and scheduled it. And 3 days later, when I showed up, he wasn't the one doing it. It was a lady I had never met before, who I don't know if she was a nurse, esthetician. I do not know what her credentials were.
I guess I don't want to know her name, but did she say anything?
She just introduced by her first name that she would be doing my procedure.
And what procedure was it?
Fraxel.
Fraxel
is what I was told.
Okay. So now she's here for resurfacing with us, which you came in and saw me. Hopefully I told you who I was.
And I came to the open house.
She's come to some of our events. So now we're numbing you up. Is this kind of the same type experience you had? Did they numb you?
They did numb me with some kind of gel for probably about 30 minutes.
Okay.
And the machine and the lady was always behind me, so I never really saw what was going on.
Okay.
So, because I keep trying to remember what the name was on the machine, but I never saw it.
So then you had the procedure, and they went over aftercare, give you product like.
I had to buy a kit, a Clinique kit is what they sell. I did everything they told me to do, and when the swelling got really bad, I texted her to call me, and she said, send me a picture. I sent her a picture, and I never heard back from her.
Did you call them back or call the?
Because I was told to go through her.
Oh, they told you to call herself in. So that's a bad experience on a lot of levels.
I was swollen for 3 months.
3 months?
Until February. The end of February is when it finally started going down.
And then when the swelling went down, what kind of changes could you see?
None. Brown spots were still there. My pores were still large. No scarring was gone.
So it takes her 4 years to get up the nerve. I'm not making fun of you. There are a lot of people out there that feel exactly the same way. And they don't, for whatever reason, either they feel like they're being vain, or they feel like there's nothing anybody can do, or they feel like it's going to be too expensive, or they're just really shy. There are a lot of reasons people don't go somewhere. But you got up the nerve after 4 years. You went, you swelled up, nobody would call you back. So you figured something really bad was
I know. I was like, well, what did I do?
So then ultimately her swelling goes down, and then you can't tell any results. No. And then how long has that been?
That was 2 years ago. This month, 2 years ago.
So what brought you... So now you're willing to try again, which must have been really hard.
Yeah, well, researching and following you, and, I've done the skin tight and the Botox here, so I've been more comfortable here.
Okay.
I'm more informed of everything.
what makes you comfortable? Like, what do we do that makes you comfortable?
The way you talk to me and tell me.
And film you. I'm not getting your face. I love the story. But
well, I mean, you sit down and you take time and you listen and you tell me what the best thing that's out there now, what's the best for my skin.
Okay.
And looking at the examples that you have and people who have gone through similar, you know, skin types, I'm just more informed.
Okay.
And I'm just comfortable.
So for 2 years, that makes me happy. That gives me chills. I want you to be comfortable, and I don't want people to accept anything less than being comfortable. And you absolutely deserve it. I mean, it's hard. I probably used a bad example earlier. But it's hard. It shouldn't be a secret. And there's this stigma, and that's what allows people to do things like and go through what you went through.
Right.
And, you know, I hate that. So 2 years later, what finally got you to come back and try to do something about it? It's been bugging you for 2 years.
Well, because it gets worse as you age.
Because you age around the scars and you start to notice them more.
And I thought, I've got to do something. And the brown spots are coming out now because I'm a typical 80s child, no sunscreen. And
right.
I've got to do something or it's just going to get worse and worse.
So today we're doing some resurfacing and we're working on our scars. And I'll share some of the laser procedure with you. But, you know, it is important that you know who, and I'm not criticizing because I would do that too. I mean, I have a very close friend that went to someone for something and was like, but celebrities go there. I'm like, but, you know, I mean, even some people don't choose people based on anything other than something like that. And there's a lot of things to choose people based on. The most important thing is once you know that someone has credentials, and people that do lasers dermatologists are very well trained in it, plastic surgeons, facial plastic surgeons. I mean, but there's learning the anatomy and knowing what you're doing, and certainly, you know, estheticians in Alabama don't do ablative type procedures with Fraxel and stuff like that. But you know, the lesson is, you know, it did take you a long time to come in. There are a lot of people out there that have had stuff that are afraid, really afraid to come in or to do anything, and especially women. I mean, hey, Cindy. Hello from Jackson. I can't wait to be in Jackson, Mississippi. It will not be long. But I really feel like this is why I do these videos. I want people to know. I always go back to Suzanne Summers and the Thigh Master and lying and saying that. Did you know about that? Well, my sister gave me the Thigh Master one Christmas. Call me Thunder Thighs. Shout out to my sister. But then when I found out she had just lied the whole time and it had liposuction, it was like, why couldn't you just tell us the truth? And this field, there's a lot of that feeling of you don't know the truth, you don't know who to trust. Then when you go trust someone and you get treated poorly and even don't feel heard and you don't get a result, like I certainly would have. I mean, you could come to me in 2 weeks, or really it takes a few months to see the results, and say, I don't see the results, and if I don't see them, I'm going to do it again. I'm not going to charge you to do it. I would never let you walk out of this practice, or I would think about you at night. Like, I wouldn't let you be unhappy with what I did, and I want to know. And you don't go through anybody but me. So you'll have... Anyway, that was my phone ringing. Some people have the best timing. Well, we are just about ready. We're going to go start, and y'all stay tuned. We're going to get back in with her. And is there anything? I know you're nervous now, but I'm going to take very good care of you.
I know you will.
Okay. So we'll get some good stuff. We'll have all your post-care together. And we'll show y'all some lasers, some scars. Acne scars are a big deal, and they really do. Especially, it's the shadows. It's the way the shadows bounce off and the way the light hits your face when you're taking a picture. So we're going to share some resurfacing in a minute, and Merry Christmas.